That's quite a lot of. I mean, I see this as a pretty in-depth, assessment of the human body, right? I mean, your hormonal state depends on a whole set of organs functioning properly, and so that's why, in a way, this super speciality kind of tags on to almost every other super speciality that exists. So, Dr. Smith, you wanted to talk about the
Yes. So with regards to the male factor, the most basic test when a male patient would walk in would be a complete semen examination. So basically, the male would provide his semen sample by masturbation in the hospital premises, and then we would look under the microscope and assess the total sperm count. So normal sperm count, according to the WHO, is 20 million or more per ml. And you would look at the motility, meaning how fast the sperm is moving in that particular field. That is also a very important aspect, because if you have a normal sperm count, but the motility of the sperm is very less, then it does not have the capability to go and fertilize the egg of the female. And then you look at something called as morphology, or how many normal forms are there. So contrary to popular perception, about 96% of the human sperm is abnormal. Only 4% is normal.
I see. That is quite a
Yes.
number.
Yes. So
Really?
that's how nature intended it to happen.
Okay.
So basically, all these three big factors which we look at, and apart from that, obviously, when this comes in as normal or abnormal, then you look at the other aspects of it. Then you take their family history.
Yes.
If they have a history of a miscarriage in the female, or an abnormality in the previous child,
Okay.
then you look at the chromosomal pattern of the male and the female both. Because sometimes their normal chromosomal makeup would be normal, but they would have something called as micro defects. This can happen. It is something called as Y chromosome micro deletion in the male, and this is special. This is diagnosed only through specialized tests, which we also offer as part of the genetic counseling of the patient.
Sure.
Then, obviously, depending on the result, there are a lot of supplements today that can help the male to increase his sperm count and motility and morphology, which is commonly known as coenzyme Q10.
Yes.
Which is a wonderful supplement which helps not just the sperm count in the male. A lot of women also can take it. It improves your general health, it improves your cognitive function, it improves your heart health, and you have omega-3 fatty acids, basically called as fish oil. Even these improve your sexual function as well as the fertility function.
Yeah. So clearly this requires a deep understanding of the subject. So it is always best to just go to a professional rather than imagine within yourself what is not right in my life or body.
Yeah, so these battery of tests that we are putting the patient through helps us diagnose the problem. And, we can probably counsel the patient the very next day. Now, what are the issues that you are dealing with,
Yes.
like whether the woman is having a PCOS, or if there's a low sperm count, as Dr. Samit said. So, the counseling and then the treatment.
It's like the heart of the...
Yeah. So, these tests should be able to help the patient, even ease the doctor.
Yes.
To help them form a guideline as in what kind of treatment will be the best for you and offer you the maximum result in a short duration of time. See, that's the advantage of getting so many tests done.
Absolutely.
It's just not that, it's to make the patient,
Go
just
through
have
these
the,
tests.
feel mere itne test. I mean, I've gone through so many tests, but what is it? But if you can, with these many tests, pinpoint, okay, this is your problem and this is your solution.
Absolutely.
It gives them a lot of
relief.
yeah.
More than anything
and
else.
just the very next day, all your reports are on the table, So you really get that confidence as a doctor, and
Yes.
definitely across the table where the patient is sitting, she's also very confident. She's very, very confident. Okay, this is my problem. You've told me what my problem is.
Yes.
This is the solution. This is how we're going to go ahead. So I think investigations in infertility are, are a real, help to the patient as to the clinician.
Absolutely.
We should, have that approach, give them those investigations, and it should be a part of your clinical protocol. And saving on that would actually, we would miss out on certain things, and then the next cycle, So the lady misses one cycle completely.
Experimental,
Yeah.
it becomes the treatment.
So, and if you can give them that hope, okay, you start your treatment tomorrow,
Yeah.
and, if her results are good, the
Yes.
next month she's pregnant. So
Yeah.
there's something which she will be And so many patients tell that, you just got my test done and
Yes.
now I come pregnant. So
Yeah, you're grateful actually for your whole life.
So you didn't do my treatment only, just test me. He gave me a pregnancy, and that's how she puts it across to her friends. Just go there, she'll just get your test done, and you might just get pregnant. But it doesn't happen all the time.
Yes, yes, yes.
So that's something which investigations do play a role.
No, that's
And it's simple as
sorry.
blood, as just simple as blood test and ultrasound, which is hardly going to be a 15 minutes job.
yeah.
Nothing more.
One important thing I would like to address is that fertility science, like all other branches of science, has advanced tremendously in the last 10-15 years. So earlier, like 10 years back, we would only have certain tests to do, and we would have had to diagnose based on those tests.
Yes.
And that time, the incidence of what was called as unexplained infertility was very high. So we would say, okay, your reports are normal, your reports are normal. We don't know what is the reason.
Yeah.
But now there is nothing called as unexplained infertility, because if you take advantage of the science at your disposal,
Yeah.
when I'm talking about the patients here, there are certain tests available. If you do that, then definitely we can find out there is some problem here or here. There is nothing called as unexplained infertility. And when it comes to affordability, India offers one of the most subsidized rates for fertility treatment in the entire world. You look at certain sub-Saharan countries as well, their costs for IVF are higher than India. If you look at the USA or the UK, the amount of fees charged for IVF in India, in the US and UK it would be about 10 to 15 times more for the same treatment.
Yeah.
So I think Indian patients can benefit from that. And also one thing that I would like to say is that the state and the central government is also offering at least basic treatments for fertility evaluation at the government hospitals. So I think patients should also take advantage of that.
Of that. In fact, Harish Rao, Health Minister, was here sometime, this is 3 weeks ago, for a similar conversation, and he was also talking about they are creating a whole battery of tests for women, especially to help women. And once a week in a government hospital will be dedicated only for women's issues. And a lot of the, because women even, can you believe it, they say that they even hesitate to come forward to talk about, say, I have this problem, the mother of the house, if she has 2 young kids, she's like, she forgets herself, and she's just, so in those tests, even these, some of what you were talking about.
Especially the working mother,
Yeah.
The working mother has 2 roles.
By the time, yes, she's done with her work and her kids and the home, and yes.
She herself is the last priority for her.
Yes. So these conversations are very invaluable for that. So you were talking about CoQ10. I suppose there would be many other supplements also which help. People take. But I think is it better that they talk to a specialist and then than randomly just take?
No, there are some common supplements, like which
You
are
can
not
take.
at all harmful at all. But at the same time, they may do immense good also to us.
Okay.
So we don't shy away or we don't hesitate from writing them in the first consultation itself.
Okay.
Because folic acid, as everybody is aware,
Yes.
folic acid, they started putting it in the food also when they realized that folic acid deficiency led to central nervous system brain defects in the baby. If the mother was deficient, then US and all, they started fortifying the food with folic acid so that that they get the minimal micrograms of folic acid.
Yes.
So that was not followed in India, but I think the doctors were very on their feet, trying to give folic acid. I remember right from the beginning, and the dose is very less, 5 milligrams or even 2.5 milligrams will be enough. So folic acid before 2 months before you are trying to conceive. Folic acid, calcium supplements, magnesium. Magnesium is another a substance which is very, very important for the growth of the wombs and for the baby and all that, and for the egg also. Then certain micronutrients like copper, selenium, all these things also are important. And of course CoQ10, and there is one more drug called carnitine. Carnitine also actually in PCODs it is very helpful because it improves the metabolism of the cells and the oocytes and all. So the folic acid, calcium, magnesium, all these things are very, very important. So if I'm missing out on
Vitamin
something,
E is one more supplement which is
DHA and
which is an
vitamin E.
anti-aging, it's been proven
Element.
to- yeah.
Yes. To
Multivitamins we give to everyone. Multivitamins and vitamin B6. B6 is also good for breast disease and for hair quality.
Yeah.
So basically, a healthy, balanced diet would negate the need for any kind of supplements. I always advise that. So a diet which is rich in protein and has a good amount of carbohydrates and a good amount of fat. So fat is something that is, treated like a villain in our diet. It should not be.
Of late.
Fat is very essential for all human functions, including the reproductive function. So it is very important that you have a good amount of good fat in your diet as well.
Healthy fat. Yes.
So having those things and checking your blood levels for all these once a year would negate the need for supplements. Having said that, calcium, multivitamins, folic acid, these are safe over-the-counter drugs. And if somebody is planning for a pregnancy,
It's a good-
male or female, they can start using that.